Yusuf, I think we can start now.
Okay, so good morning, good afternoon, good evening, everyone, from wherever you are joining, and you're welcome to our cross-regional exchange and learning series on family planning and UHC. Sorry for the little delay. We are about to start. I would like to thank and appreciate everybody for joining this webinar, which is organized, to foster learning on policy, programming and research on family planning and UHC. As a reminder to everybody, this webinar will be recorded. Can we go to the next slide, please? My name is Yusuf Nuhu. I am the Advocacy and Partnerships Manager working for FP 2030 at the Northwest and Central Africa Regional Hub, hosted by Population Council here in Abuja, Nigeria. Next slide. All right, in terms of some logistics for the webinar, you would have seen in the chat box for you to select your preferred language. If you go to the bottom right, you'll see a globe which has French and English translations, which will be done simultaneously. So if you pick your preferred language, don't forget to mute the original audio. Also, please disable your video as it may affect our connection. Let us save the bandwidth so that the webinar will be seamless. We're also recording this session once again, and the presentations of the recording will be shared to all. Next slide. Can I have the next slide, please? All right, so in terms of some of the conversations that we are going to be having today, we're going to be having some panelists from the West Africa region to also help us in terms of conversations on family planning and UHC integration. So by way of outline, we are going to introduce those panelists to you. Firstly, there's Dr. Kofi Issa, who is the Director for Family Health in Ghana Health Services in Ghana. There's also Tiaba Sembeni, who is working with the Ouagadougou Partnerships Coordinating Unit, as well as Dr. Euphrasi Ajami Bari, who is working from Burkina Faso. We hope that Udame Marie will also be available to join us. Following the introductions, we are going to have a conversation with these experts in integration of family planning and UHC. Following that, by way of our outline, we'll go into a question and answer session where we'll give the opportunity for our audience to also participate in the webinar. Kindly put your questions in the chat as the webinar go on, and would expand that conversation when we get to the question and answer sessions. And then finally, we'll be wrapping up the webinar and making some closing remarks, as well as some recommendations and any further information that may come out from what we have discussed during this session. Next slide, please. So I mentioned that we are going to be introducing our panelists. First up, in terms of the introduction, I will be introducing Dr. Kofi Issa. Dr. Kofi Issa, as mentioned, is the Director of Family Health at Ghana Health Services. Dr. Kofi Issa started as a house officer who taught at the teaching hospital in Kolebu. He rose up through the ranks over the past 25 years, working for the government of Ghana, and is currently the Director of Family Health in the Ghana Health Services. Dr. Kofi Issa was a pioneer medical officer under the Wale Wale and Sevelugu health centers, which were converted to district hospitals in the year 2000 and 2004 respectively, and also contributed in making a final push to eradicate guinea worm in Ghana with focus on Sevelugu Nandu district, where they implemented under his leadership contributions that were expanded and scaled up to eradicate that in the country. Dr. Kofi Issa, you're welcome to this webinar. Also on this call is Dr. Ajami Bari. Dr. Ajami Bari is an obstetrician, gynecologist, and public health doctor, who is the mission manager in the Office of the Minister of Health for Sexual and Reproductive Health and chair of Generation Equality Regional Coordination Committee. As coordinator of the Sexual and Reproductive Health Program and technical secretary for Accelerated Demographic Transition, she led the development of the FP 2030 commitments in Burkina Faso, National Family Planning Plan, National Framework for Family Life Education, regional commitments of Generation Equality Forum, as well as she is a trainer in family planning, female cancer screening, as well as an expert in the area of female genital mutilation, and an activist to see an end to female genital mutilation. And then finally, there's also Tiaba Sembeni. Tiaba Sembeni works with the Ouagadougou Partnership Coordinating Unit, providing support for civil society across the Ouagadougou Partnership countries. She's also a family planning and sexual and reproductive health activist. Panelists, you are all welcome to this webinar. So we would like to dive into the webinar itself. But before then, once again, I would like to thank everybody for joining the webinar. We appreciate your presence. And secondly, would also like to thank our hosts, FP 2030, as well as Knowledge Success, who worked tirelessly to ensure that this webinar is a success. We would also like to send our appreciation to the Ouagadougou Partnership Coordinating Unit, as well as the governments of Ghana and Burkina Faso. Once again, thank you very much to everybody. So first up, we'd like to ask Dr. Issa, who is going to share with us how government of Ghana instituted landmark political and systemic changes leading to the inclusion of family planning in National Health Insurance Benefit Package, thereby expanding access to family planning to women and girls in Ghana. He will be sharing with us some of those country learnings through the whole process that led to this landmark political and systemic changes. Dr. Issa, if you're ready, the floor is yours.
Yusuf, it looks like we've just lost
Dr. Issa, yes.
Okay, so apologies to everybody. Probably the network in Ghana is not, up to speed, and we lost Dr. Issa. However, we're going to go straight to Dr. Ajami Yufrisi Bari. Dr. Ajami, who is from Burkina Faso, will share their experience in integrating family planning into UHC strategies, some of those lessons learned, as well as progress of implementation and challenges of note to other countries. After which we would also ask Dr. Ajami a few more questions before we go to our next panelist. So Dr. Ajami, if you're ready, and when we get Dr. Issa back, we're going to pose his own questions. So Dr. Ajami, over to you.
Merci beaucoup. Bonsoir à tout le monde.
Thank you very much, and good evening to everyone. It's a great pleasure to talk about some passionate subjects such as family planning and sexual reproductive health. To answer your questions, I would like to tell you that in Burkina Faso, there has been a political commitment. It was a high-level commitment through some initiatives. We have, for example, worked on the national plan and economic development, social development, and our objective is to guarantee to all the access to quality and health advantages. Hence, strong decisions have been undertaken in this commitment. Hence, the adoption of the law of insurance in 2016. There were measures that were undertaken. So free of charge access to health to pregnant women. It was a ministerial decision. And in 2016, we have the Caisse Nationale that was undertook some major decisions. We have had some judicial laws that reinforced the launching of the process in parallel. We've had several steps that were undertaken, the evolution of the package of health package, depending of the targeted populations. There were the setting up of a major reform to have like a universal health coverage. So we can say that in terms of what we've done, we've recruited health agents, and I will come back to this. So the vision was to expand the community health. In terms of demand, there were some gratuity measures, the health coverage, universal health coverage that was put in place, and we've worked with community and professionals to allow that to happen. For example, we can talk about free of charge benefits so that 19 million population people benefit from. We've partnered with other organizations. We've recruited 51,000 of users, contraceptive users. These are examples that show the commitment, and we've had defined a very good package in health package, and we created categories to benefit the population. So we had a package, an initial package that fostered the free of charge deliveries, and at the hospital level, free of charge pregnancy services, and of course the and pre-cancer treatments for the benefit of some mothers. We've had follow-up indicators that allowed us to ensure that everything works well and that everything was good to go. We had followed the guidelines of the World Health Organization. In addition to that, we've worked with 13 regions in the country, some sanitary districts, health districts, and we put some tools for the gratuity and the free of charge of certain benefit to follow up with the process. In addition to that, we have free of charge platform that allowed us to manage the process, and we've done follow-ups through NGOs. They have worked for us to follow up with the citizens and make sure that the process was efficient. So children below 5 years old and women benefited from this process. We have the follow-up that we've done, and we have health agents that we worked with. We have 18,000 health agents at the community level that work with us. And 2 months ago, we added 15,000 agents to this process. So we are, so to say, within a country that suffers from health crises, a climate crisis, but we have a security crisis. We are attacked by terrorism. So since 2015, we've suffered from terrorism. So we work a lot with organizations of civil society, and we do communicate with them and cooperate with them. So we've done our best to hire agents, and we have expanded our health network to follow up with the process. I will stop now, and then I will come back to elaborate more on my perspective.
Thank you very much, Dr. Ajami. As a follow-up question to you, we would like to know what were the entry points for integration and the approach, for policy formulation. What are those entry points that led to, government having that buy-in into ensuring that, this policy is accepted as well as developed and implemented?
Alors, merci beaucoup. Ces points d'entrée, c'était
Thank you. Entry points were essentially family planning that allowed, through the free of charge planning since 2020, to ensure that at the population level, family planning, the contraceptive methods, the free of charge of these methods are together and hand going with other processes, and all of this is done with the supervision visits from the Ministry of Health. But the first thing was that we've done was the commitment of the civil society that allowed us to do this follow-up. We need to recognize that I'd like to congratulate this high-level commitment. It's a high-level commitment that that was translated into text, decrees, and project laws to start with an initial package. The initial package was mainly revolving around the family planning, postpartum benefits and interventions that accompanied all the process. So I am a gynecologist by training, but I would like to tell you that we have started by ensuring a good coverage. I'd like to insist on the sharing of experience. That was very important. I would like to insist on the work that has been undertaken with organizations of civil society that allowed us to put in place that follow-up. So we have like 33,000 health agents that ensure that kind of coverage. So we ensure the free of charge benefits. So these gratuity has allowed us to reach that universal health coverage. We've had like community centers, of course, that we put in place. We are still, so sexual and health reproduction was something that we insisted on. The health of mothers and kids were our starting point for the health universal coverage. We need to say that also for major countries of the region, we've worked with the technical and financial partners, and we've worked together with other benefits. So we will have the opportunity to delve more into details. Thank you.
Thank you very much, Dr. One final question before I leave you temporarily. I'm sure that there would have been challenges and that you encountered. How have you been able to adapt the approaches, vis-a-vis the kind of challenges you have encountered, and why and how did you address those challenges?
Alors, l'une des premières, merci beaucoup pour votre question.
Thank you very much for this question that is very interesting and relevant. Well, listen, What has helped us was the financial resources, but that was one of the difficulties that was to aim. But of course, this restricts access to healthcare, but also a lot of healthcare centers had to shut down, unfortunately. And in terms of healthcare coverage, this has also been largely reduced. But thanks to a lot of resilience, we have had to reconsider all these approaches in order to ensure complete coverage for everyone. But you know what? Even the training of all these healthcare providers was important, supervised by the first level healthcare providers. All of them supervise these healthcare providers. And for example, as a practical example, we were distributing condoms to everyone. And this led also to distribute oral contraceptive medication. And thanks to all these delegations and all these agents who helped us reach out to a major part of the population, this allowed us to address all these difficulties linked to access, linked to coverage of the population, especially for all those populations that were unreached. And within this population, we have managed to reach out thanks to all these agents, and we overcame the closing of all these healthcare centers. We were working with the Central Office of Medicine Development, and they were able to provide us all the necessary medication treatment all the way up, despite the security issues, despite the closing of these healthcare centers. And we have reached, and despite over 2 million displaced people internally in the country. And thanks to them, we have managed to do it. This was the perfect model that we have managed to work with, and we have turned this pyramid around and sharing information, education to change the mentalities and change the social outcome. A lot of activities are being developed, communication is there, and this helps us have an impact on the healthcare system. It is important that we all be resilient in the face of insecurity. Putting in place all the reforms and the national healthcare insurance. I mean, we all know it, to ensure that there is an equitable distribution of health. The financing of all these programs was necessary. And of course, it is necessary for us to act on communication and ensure that we implement all these different reforms. And we also improve and push for this program of cotization in the healthcare insurances. We make sure that everyone is taken in consideration, and this has helped us overcome this universal health coverage. Thank you.
Thank you very much, Dr. Ajami. We'll come back to you later. I'd now like to move on to Tiaba Sembene. Like we all know, the role of civil society is very important in us. The landscape for family planning in Francophone West Africa, an insight for entry points for family planning and sexual and reproductive health and rights integration in UHC strategies, given how current health regimes are designed in Northwest and Central Africa. Tiaba, you're welcome, and over to you.
Merci beaucoup, Youssouf.
Thank you very much, Yusuf, for this introduction, and allow me to focus my intervention on Western Francophone Africa. With regards to this landscape of family planning in Western Africa, the partner of Ouagadougou, that was the partnership with Ouagadougou that has been put in place since 2011 with the support of other countries in Western Africa. A lot of efforts have been developed and passed on to the governments, all these donors, civil society and youth, and all the partners that have helped us to execute this partnership. So thanks to this creation of partnership, we have had put in place common objectives in order to put in place the right activities for family planning. And in 2001, this objective was set to 6.5 million new users between 2020 and 2030. Last year, in 2022, we made an assessment, a local assessment, and realized that for the year of 2022, we had 454,000 new users that have been considered in the countries partners with Ouagadougou, 5 million more than what the objective we had set. So what helped us reach this objective? Well, we developed different strategies. So the strategy beyond 2020, the strategy for civil society, and the strategy for youth. These different strategies allowed us to have a real long-term vision and face all the challenges that were set in front of us and that is the region is facing. I would just like to come back on this youth strategy that helped us mobilize the youth of the region that represents over 60% of the population and who definitely have needs in terms of family planning. The civil society, as we all know, works in this section of family planning and sexual reproductive health, and the fact that we work as a partnership allowed us to really coordinate all our efforts and provide real visibility for all their actions undertaken. Yes, research is taken in consideration because we have just launched our research and agenda to allow all the research institutions in Western Africa to undertake their own studies and carry out their own vision, while strengthening the capacity of the research institutions and civil society organizations who require certain specific research plans and who don't have the necessary data that could help them reach their objectives, especially when it comes to family planning. Within this research agenda, it is very important within the family planning framework in Western Africa. So despite all these strategies, yes, challenges do remain. Dr. Ajame spoke of the humanitarian context and different partner countries of Ouagadougou are suffering from this humanitarian context. And this is part of the definition and the identification of the users of family planning, but also the need of putting in place the right infrastructure to allow women access to contraception. So a crisis situation is definitely something that is present within this landscape. Another point that is quite important to put forward is the demand. Between 2012 and 2022, the demand has increased by only 5%, whereas we don't feel fully satisfied with all the needs that we are meeting. In the region, it's only 2% increase between 2012 and 2022. These figures should push us to address this further and really address the issues that our communities are facing in terms of family planning. And we do believe that the integration of family planning within the universal health coverage will allow us to decentralize family planning, but also allow the least served communities to have a better access to family planning, especially for the youth who don't necessarily have the means, the financial means, often unemployed, often lacking information on family planning to access all of this. When it comes to this landscape of family planning, I must say that the organizations of civil society have played a very important role in this set up. Yes, not all countries have seen the family planning being integrated in the OCS, but in Burkina Faso, I mean, like it happened in Burkina Faso, integrating peace within OCS also helped us reinforce the health programs for childbirth, but also helped us reduce the mortality rate and improve the health services for women and children. Real relevant actions were undertaken by civil society. Dr. Ajame spoke about it. La Veille Citoyenne to ensure that the UHC be available in all the communities. In Ghana, for example, the Organization of Civil Society did an advocacy for the integration of the family planning within the universal health coverage, and we have decided to undertake something called FP 2030, so the Family Planning 2030, in order to ensure free services. Considering Senegal, family planning is not included in the healthcare insurance. It's a different setting. In Senegal, the Organization of Civil Society have mobilized different domestic resources when it came for the hundreds of women and children who decided to have access to these services, but this allowed all women, pregnant women, to access free consultations pre-birth and post-birth, and also have some free screenings and free childbirth and access to medication with real resources that were not very important. But these amounts are really minimal. We ask them very minimal amounts to access to medication and proper treatment. So integration of the universal health coverage and the integration of family planning to this is a very important request in the region. And most of the countries have integrated this program. And I do believe that the civil society organizations and their partners need to work further for it to be really implemented on all levels. Thank you very much.
Thank you very much, Eva, for that elaboration of some of the roles CSO play in integration of family planning in UHC. I will be coming back to you with also another question, but I would like to quickly go back to Dr. Ajami, who I would like to ask, for countries that are about to embark on their journey on developing their own family planning UHC integration strategies, policies, and programs, what are some key notable things that they need to take into consideration while doing this?
Merci beaucoup, Youssouf. Alors,
Thank you very much for this question. Well, I would say one point would be to have a very strong political will, because a lot of laws will be decided and decisions need to be taken. And to me, we need to have a very strong political will to be able to undertake these projects. Of course, then it is necessary to see the elaboration of the document, especially mentioning the free healthcare coverage and the universal health coverage and the free treatments. So we do need to create the right documents for this family planning to be able to be put in place, all the procedures and the guidelines and how we're going to be able to put this in place for everyone. Also, we will need to identify the beneficiaries and maybe put in place the right plan for the strategy. Everyone needs to understand it, everything needs to be organized, and everyone needs to be involved, all the actors at all levels. It is not a government activity, and it is not an activity driven by the civil society organization, but everyone is undertaking these activities. And of course, we need a collaboration, an interministerial collaboration, and a collaboration within all the right ministries and the Ministry of Health, and provisions of proper medical treatments. And we need proper medication. We need the hospital pharmacy to be provided with all necessary medication, and we need a proper community health program that would be efficient. And I would like to also speak of all the healthcare providers, community healthcare providers who are serving the community, because they are choosing their representatives in order for them to act for everyone, and especially for all these areas that are difficult and that are not reachable. A clear example when it comes to this resilience section, we have to consider insecurity within our context. We are continuing the basic care for our population, and we need family planning to be available for everyone. It is important that we consider this for all these countries who are suffering. We need to insist on the high level commitment of everyone and the fact that it is crucial that we work together. It has to be on a participative level. We have to be ready, all of us together, hand in hand. Thank you.
Thank you very much, Ajami. It is by all for all. We'd like to go back to Dr. Kofi Isa, who we hope will share how the government of Ghana instituted landmark political and systemic changes leading to inclusion of family planning in national health insurance benefit packages, thereby expanding access to family planning to women and girls in the country. Dr. Kofi Isa, you're welcome, and over to you. Dr. Isa, you may need to check your audio. Okay, if you're on mute, you'll be able to speak. We'll be able to hear you.
Yusuf, it looks like he just got connected to audio, so you might just want to ask one more time.
Okay, so Dr. Isa, if you're with us and can hear us, would like you to share. Yes.
Yeah, hello.
Yes,
Yeah,
thank you
hello.
very much, Dr. Isa, for joining.
Yes. My network has been very poor here because it's been raining. So I keep going on and off. So I'm beginning to now follow things. Yeah. So I'll listen for some time. Then if I have a submission, then I'll then make.
849. 2.
Okay.
Yeah, hello.
So while we wait for you to sort that out, I would like to go back to Tiaba. Tiaba, for civil society organizations in countries that are about to embark on the UHC journey, what advice would you like to give to them?
Merci beaucoup, Youssouf.
Thank you very much, Yusuf. In terms of recommendation, I think that we have to boost the community health services to allow better access of the population to family planning. So civil society has a major role to play in this sense. I represent civil society, but there are implementing agencies like governments through programs and policies may very well boost and help civil society to work well in this field. The task delegation is also an important is a very important factor in decentralization. These are very important factors that will allow to boost and to reinforce the health coverage. involving youth in the process is a determining point because youth constitute the majority of the population, especially in West Africa and in Africa in general. So it's very important to have like targeted actions for these youth to take into account their needs in terms of reproductive health and family planning. It is important to work on regional disparities and gaps, whether we are in a city or in rural areas, we have to take that into account. Or whether we are in the South as well, we have to be able to look at these disparities and allow a better access of the population to family planning. So this is in terms of recommendations that I wanted to share with you guys.
Thank you very much, Tiava. We'd like to now open the floor to our audience who may want to ask questions by our panelists. The floor is open. You can go live or you can type your question in the chat box. So audience, the floor is yours.
We have a hand, Yusuf, from Mama Etane.
All right, Mama Etane, go ahead with your question. Go ahead, your question, Mama Etane.
It looks like they're unmuted, but we cannot hear them.
Yes, we can't hear Mama Etane. Is there anybody whose hand is up?
Have any other hands, Yusuf? We can try to see if Dr. Issa can intervene.
Yeah, so we'll go back to Dr. Kofi Issa. Dr. Issa, can you hear us? Dr. Issa, can you hear us? I don't think Dr. Issa can hear us at this moment.
He is on, maybe he's just muted if he's speaking.
Dr. Issa, can you unmute, please?
Hello? Yes. Hello?
Yeah, Dr. Issa, if you can hear us, we would like to hear the Ghana experience in instituting the landmark and systemic changes leading to inclusion of family planning in the National Health Insurance Benefit Package in Ghana.
Okay, I only hold you will here because I'm in a very noisy area. But then, what happens is that, you know, Ghana started with a free maternal and child health service package somewhere in the 90s. By the early 2000s, this whole package became official policy. And so with the start of the National Health Insurance, what do you call it, scheme, it was decided that maternal and child health services would be free under that package. But that was just said in passing. But the components of the, what do you call it, services that were rendered mostly were in the areas of immunization and safe motherhood. So though it was written into the health insurance, what do they call it, law, but then family planning still continue to stay out of the mainstream of the benefits package. So about a number of years, about 4 or 5 years ago, the Population Council, MSI, the Ghana Health Service, and the National Health Insurance Scheme then decided to do a pilot in a number of districts, in about 3 or 4 regions, to be able to actually demonstrate to policymakers and all other stakeholders the benefits that would accrue from actually adding the family planning package into the benefits package for maternal, child health, and reproductive health services. So this was carried out in the demonstration districts, and gradually the other districts which were not even in the demonstration districts learned to actually pick up some of the interventions. So in 2020, 2021, the evaluation was done, and then at least the case was done to the Parliamentary Select Committee on Health and other stakeholders based on the actuarial studies showing the benefits of actually including family planning into the National Health Insurance Benefit Package. And that has been on the, what do they call it? The long-term methods. And so 2 years ago, there was a policy announcement. And so with the pilot districts which had taken the lead, a bit of sensitization was done for all the other regions, the 16 regions of the country. And then training has started both for the National Health Insurance district and regional offices and the service providers, both private and public. Uptake has been quite high in some areas, but it still is low in many other areas. And that is something in which we are working at to be able to close these gaps. And that is why in our FP 2030, what we call priorities, we have put that by the year 2030, we shall have had this fully implemented in all facilities all over the country where these services are provided. So that has, in short, that has been our journey. Thank you.
Isa, I would like to now go on to Celestine Kapaure from Burkina Faso, who has a question. And later on, we'll come back to Dr. Isa for 1 or 2 more. Celestine, go ahead. It seems Celestine is not with us, but in the chat box, I also see a question from Malawi, which says, we are still grappling with issues of unsafe abortions, and there are best practices that can be shared here on how some countries have advocated and won the battle. I would like to pose this question to our panelists, if they have, any of those best practices that they can share. We'll start with Dr. Ajami.
Alors, merci beaucoup.
Thank you so much. Yes, in Burkina Faso, we secured and abortions is undertaken within supervised conditions, and for that we need a lot of advocacy in this process. All what we've done really revolves around this process of advocacy. We have to have consensus and a participative approach. We have to work with organizations of civil society to create a favorable and appropriate environment for conducting for interrupting pregnancy according to the law, and it's also work that has to be undertaken with other government agencies, with ministries, etc. I would like to say that it's very important to do advocacy at parliament level, at the level of system that creates appropriate environment for sexual and reproductive health and more particularly to the interruption of secured interruption of pregnancy.
Thank you very much.
Considering this approach, participative, consensual approach. Apologies. Thank you.
Thank you very much, Dr. Ajami, for that. Celestine, are you there? Celestine, can you unmute?
Do you hear me now?
Yes, go ahead in French or in English.
Thank you so much. French, I will go in French to be sure. Je voudrais merci beaucoup à Dr. Ajami pour le partage de l'expérience du Burkina.
I would like to thank Dr. Ajami to have shared all the experience in Burkina Faso, and thank you for everyone. But I would like to ask a question to Dr. Ajami and Issa. What are the main challenges that you have met that your two countries meet, especially when it comes to mobilizing partners and setting up the universal health coverage plan and the family planning? What are your main challenges? Please tell us.
So go with Dr. Issa first, if he's online.
Yeah, hello.
Yes, we can hear you.
Yes, what was this because I went off, the network went off. I'll join again.
So the question is, what were the main challenges in mobilizing partners to ensure that inclusion of family planning in the UHC journey?
Well, first and foremost was to be able to get the partners whose objectives to really align with the country's own family planning objectives. That was the first thing, to be able to get such partners. The second thing was the quantum of funding and for how long what the pilot phase was going to take, and the scope of why we were going to carry these things out. So these were the two challenges that we first faced, and once we were able to surmount these, we then proceeded. Thank you.
Okay, Dr. Ajami, over to you.
Merci beaucoup pour la question.
Thank you very much for this interesting question. Indeed, everything related to financial resources, as I mentioned it earlier, has been complicated. The first challenge was indeed to gather the right financial resources in order to execute these strategies. We do need these financial resources. And the first difficulty was to align all the partners. We often talk in Burkina Faso of this one plan, one budget strategy. So we do ask our partners to align with our strategy and our priorities. So bringing together all these partners and making sure that they are all sailing the same boat as us, and ensure that we have also the availability of all these contraceptive medication products. And that was important, make sure that we have sufficient stock for that. And of course, a financial support is necessary to reach this objective, while having a full commitment from the higher authority, because these decisions are taken at a very high level, so having their support is mandatory. Thank you very much.
Thank you very much, Dr. Ajami. Are there any other hands up? So if you can see them, see them. Or questions, chat. We've seen a request from Mama Esti from South Africa. We sure do send you the recordings. They will soon be cut off from the webinar. We'll definitely share the recordings with everybody. So before we go, I'd like to go back to Tiaba to hear from her. What are some of the challenges CSOs are facing in terms of implementing advocacy strategies for family planning in UHC? If you can share some of those with us.
Merci beaucoup, Youssouf. En fait,
Thank you very much, Yusuf, for this question. Well, in terms of challenges met, especially from the CSOs, first of all, I will probably talk about coordination difficulties, internal coordination or internal communication, bearing in mind that we have a plural civil society organization that works within the SHR, but and we also need to open to other sectors like education and thematic differences, and consider gender equality, et cetera, gender equity. So we need to gather all the organizations to make sure they work together and address all the challenges linked to access of women and children to family planning. So the difficulties we are facing, yes, are coordination, collaboration, or communication issues mainly. Secondly, the humanitarian context that we raised earlier. It does not allow the execution of certain activities in difficult areas, and CSOs do not have the technical or financial means to really set foot in these areas. And better gather the actual demand of family planning, and also the number of potential users of family planning. Dr. Ajame spoke of the financial means earlier. Yes, it is very important, especially for the CSOs. And for certain countries where we don't have that many partners who can support us. But in summary, I think this would be it. The humanitarian context, the openness to other sectors, and the financial burden that we're facing. Thank you.
Thank you very much, Siaba. Before I let our panelists go, we'd like to have a final word from each and every one of you. So, Dr. Jami, what will be your final word on this webinar?
Thank you for to everyone for this great interest. Now, to close this webinar, I would like us to insist on the fact that putting in place this universal health coverage requires progressiveness in the reforms. We need to be realistic. There is no miracle recipe, and each country has to adapt to its own reality. We need to face the security crisis and the health crisis, but security is a major burden, and we need to adapt also our response. And we have adapted our response to all these issues, and the lack of access to all these services. We also are facing a serious equality issue in the entire territory, and especially for those who are far away and non-accessible. Also, we need to ensure that we have strong governance, because only with a strong governance will we be able to succeed in our strategy. And like I said earlier, the multi-sectoriality is mandatory for us to access this and to succeed. We will not be able to work without the civil society organizations who are doing a lot when it comes to creating security environments. We will not be able to work without our partners, and we will not be able to work on all of this without the right techniques, the funding, and with all our partners, ministerial partners, and also, yes, multi-sectoriality is important for us to cover the entire territory and not leave anyone behind. Thank you very much for allowing me to speak to you and really raise these different issues and be heard. Thank you very much.
Isa is there. Would like to have your final word. We'll go on to Tiaba for your final word.
Madame. Thank you very much, Yusuf. So I would like to thank, of course, FP 2030 for initiating this very, very useful webinar. My last few words would be to say that the political context is really favorable in terms of integrating the family planning within the universal health coverage. So we would need to work together in order to coordinate our efforts and especially mobilize the domestic resources to make sure that this policy be realistic and be executed properly. This is in link with free service. And of course, when it comes to free service, nothing is really free. Someone somewhere is paying for it. So we need to be able to ensure that everyone in Western Francophone Africa is taking consideration, but also we need to recognize the work undertaken by the civil society organization, because we also need to work on all these projects and improve the number of individuals who receive this health coverage, and this can be done with the union centrals. It is the role of the civil society to mobilize all the actors and ensure they all reach universal health coverage. Multi-sectoriality is definitely something very important, and to ensure sustainability of all this in Western Francophone Africa. Thank you very much, Yusuf, for your attention.
Tiaba, at this point, by way of wrapping up, we have heard from our speakers who have taken time to share and elaborate some of their experiences, both at country and regional level, and some very important and key points, of note from what they have shared include the importance of having a very high level commitment for the drive towards the journey for integration of family planning into UHC. High-level commitment is very, very key and important. Of course, alignment with other national development goals and strategies, including national economic development strategies. We would also had the significance of adopting and adapting tools and guidelines like the WHO guidelines, amongst other tools, to help shape those strategies that countries, may adopt. Importantly, it was also shared that community engagement is, really, really key in order to have, very good integration and scale up of family planning in UHC. It's also important to do a lot of system strengthening, including recruitment and training of healthcare providers. Linking UHC and with PHC and by extension the community is, also very, very important. As such, it is really important to have some of these strategies integrated in already existing strategies and initiatives by implementing geographies. In terms of some challenges that were highlighted during the webinar by the speakers, we've had, challenges around financial resources for implementing of those strategies. For civil society organizations, there's also that importance of instituting a well-oiled coordination and collaboration mechanism to ensure that advocacy leads to catalyzing action and commitment by country governments to ensure that they really act and be true to their word in terms of the integration of family planning in UHC. There's also the challenge of reaching other geographies that are difficult areas, as well as financial resources to be able to implement strategies by civil society organizations. On the part of Ghana, I would have heard that the journey for integrating family planning into the benefit package for UHC is a very long one. It took them almost a decade and a half to, have that signed and fully integrated into their benefit package. But also important to demonstrate that in doing so, there are a lot of benefits that will accrue, for which Ghana was able to do some pilot in some demonstration districts where the pilot was able to demonstrate and have a case for the accrual of benefits of family planning in the national benefit package, which of course led to the countrywide integration of that strategy. From time to time, evaluation of the process we have seen from Ghana is also very key, and the importance of alignment of partners who share the same objectives with you in the journey for integration of family planning into UHC. Those are some of the key points that we have heard from our speakers on this webinar. I would like to once for taking time out of all their busy schedules and participate and make contributions. I believe the audience is going to leave this room with some key points and key messages that they can use to in driving their own strategies or developing and driving their own strategies of family planning into UHC. I would also like to acknowledge the contributions, especially behind the scenes, from my FP 2030 colleagues who have worked also tirelessly to ensure that this webinar holds and is successful. Thank you very much. I would also like to thank our partners, the Knowledge Success, for also contributing to ensuring that the webinar holds and it is successful. Finally, I would like to remind everyone of the FP 2030 policy paper on family planning and UHC as a resource for guiding efforts of integration of family planning in UHC. A link to that paper will be shared with you in the chat box. Do visit the website and take a read on that policy paper. I'm sure it also has a lot of information that will be useful in your drive towards integrating family planning in UHC. Finally, I would also like to remind everybody of the second high-level meeting on universal health coverage, which is due to take place on 21st September 2023. At this meeting, governments are supposed to adopt, a new set of commitments to accelerate universal health coverage implementation. As such, it is important for all hands to be on deck to drive advocacy that will lead to action that is needed by all these country representatives to ensure that family planning strongly feature in that conversation. Your contributions will be highly appreciated in driving and mobilizing all stakeholders to ensure that, governments make sure that family planning is featured in that conversation. For there would be no UHC or SDGs without family planning. So thank you very much. If you need any information, you can reach to us, visit the FP 2030 or Knowledge Success websites and other resources. You would be able to get a lot of information that will be helpful to you. Otherwise, you could also send us emails or questions, and we'll be able to respond to you. Thank you very much. And we bring this webinar to a close. Bye and out.